Welcome, everyone. We are so excited for you guys to join us on our second mini webinar in our series of mini webinars. This one is on a really fun topic of cool sculpting or reversing your quarantine 15. I know a bunch of us have been snacking heavily during the quarantine, so we're all looking for ways to get rid of the extra bulge, especially in time for summer. So we're really excited to share this topic with you, and just wanted to give you a couple updates on how the tech works. If you have any questions during the webinar, just pop those in the Q&A field and we'll wrap around to questions at the end. And or if you're having any technical difficulties, you're certainly welcome to address those in the Q&A, and we will get back to you. So I just wanted to start by introducing the practice. We are coming to you from the Piazza Center, and we are a clinic for advanced skincare, but we're also a plastic surgery center. If you have not met our two doctors, they are just amazing. Dr. Piazza and Dr. Antunes are our board certified plastic surgeons. Dr. Piazza focuses on breast and body, and Dr. Antunes focuses on facial plastic surgery. So we would love for you to come in and meet them and have a consultation with them if that's something that you're interested in. We also have a great family of advanced nurse injectors and estheticians for all your skincare needs. And we've got a really great new technology that we're just starting to use this month called the Visia Skin Analysis, where we can take a deep dive look and an objective look at your skin to see where we can make some changes and suggestions to give you that all-around glow and reverse the signs of aging that we always want to do. So we'd love to offer you a free Visia Skin Analysis with Allison, our advanced nurse injector. You're welcome to reply to our email tomorrow if you'd like to schedule that, or just give us a call anytime. So today I want to introduce you to Michelle Jacks. She is our CoolSculpting expert and our trainer, and she helps us out all the time with making sure that we are always up to date on the best techniques for providing CoolSculpting treatments. And she has been doing CoolSculpting treatments since 2012. So we feel like she's got it pretty down, and we're going to let her take it away now to share some information with you.
Hi, everyone. Thanks, Allison. Again, my name is Michelle. Happy to help answer any questions that you guys might have. We're going to kick it off with some fun facts. First of all, CoolSculpting is non-invasive, FDA cleared. We freeze away stubborn, unwanted pockets of fat. Sometimes it's hard to get rid of just those last few little pockets of fat with diet and exercise, and that's where CoolSculpting can really come in and be a game changer for you. The CoolSculpting difference. So as I said, we are FDA cleared. We are non-surgical. We say little to no downtime. It's typically no downtime at all. You may just have some tenderness or soreness in the treatment area. No big deal. Most of the time people can go right back into daily activities, back to work, playing with kids, even working out, no problem. We are the #1 non-surgical fat reduction treatment. We are #1 in the entire world, so not just here in the United States. We have over 100 publications that are available if you just search it online, to be honest, just to show little case studies, little here and there, things that doctors took it upon themselves to take a deeper look into. Not only that, but we were very thorough in our clinical studies. So we talk about the effects or effects that don't happen with other areas of the body, such as the skin, the nerves, things like that, lots of safety features. We also, this slide says we've done over 7 million CoolSculpting treatments. That number has risen to over 8 million, which is huge. We unfortunately just don't have this slide updated yet, but 8 million is very exciting.
That's awesome.
Yeah. Areas that bother you the most. So again, this is great for little pockets of fat that are just stubborn, that are hard to get rid of genetically. Maybe you just have more fat cells in that certain area. We're FDA cleared to treat 9 different areas of the body. And they're listed here under the chin is a big one. So our 9th FDA clearance is actually indicated for once we reduce the volume under the chin, we're actually FDA cleared to tighten the skin as well. So you'll get a little bit of nice retraction there, which is always a huge concern when people are wanting to remove the fat under the chin. So I think that that's great. So the way that CoolSculpting started, or was discovered, so to speak, were these Harvard University scientists. They were also ER doctors. So what they started seeing or noticing is that children were coming in with redness, inflammation, numbness in the cheek area, and they all had a common theme. So it was children eating popsicles. So they ended up calling it popsicle paniculitis. Well, later on, they started to realize, well, this keeps happening, but all of these side effects tend to resolve on their own with no big deal. Maybe some thinning of the cheeks, sometimes even like a dimple or something here and there. So what they talked about and decided was there must be a correlation between the cold from the popsicle and the fat cells in the cheek that was causing this to happen. So this is why I'm not a Harvard scientist, because I would have never thought, hey, let's look into the popsicles in the mouth of the children's and the thinning of the cheeks. But good for them, because they gave me a job today. So, so let's move forward. I really apologize. It looks like this slide didn't load properly, and there should be some images here, but it was basically a demonstration of targeting fat cells, targeting different parts of the body. So what these photos would be showing you is that you come in with a certain number of fat cells in this treatment area that you would like to reduce, and then CoolSculpting is applied. We freeze the fat. They actually freeze and crystallize the fat cells, which causes them to die completely. And then following your treatment, once your results are final, and then you just have a 20 to 25% less fat cells in that treatment area. So it's just a reduced number of fat cells. So here's another image to basically portray what I just said. But here's another cool thing to understand about fat cells is when we eat fatty foods and the fat from those foods that we're consuming is stored in our body, that fat is evenly distributed through every fat cell in your entire body. So a lot of times we hear people say, oh, it's going to go straight to my thighs, or it's going to go, straight to my belly. And it does, it gives us that illusion. The reason why it does is because genetically you may have more fat cells in your chin area, or you may have more fat cells than the next person, than your best friend. You may have more in your outer thighs, and your friend may see it come in her arms. So what we're doing is reducing, targeting, figuring out where you see that fat accumulating the most or growing the most, and that's the area that we target with CoolSculpting. So once we treat that area, you have a reduced number of fat cells in that target area. So then when you do eat those fatty foods, there's going to be significantly less fat stored there, because we're taking away significantly less fat cells in that area. A big question that we get a lot is, well, if it can't go to as many fat cells in that area, then is it going to go somewhere else? It's kind of a yes and no answer. So yes, because again, your fat is evenly distributed between cells, but because you have 25% less cells in that, let's say, lower abdomen area, then that 25% of fat that you're consuming is going to be split up evenly between every other fat cell in your body. So yes and no. It's not going to be a drastic, if you now have a flat stomach, your arms are going to get huge. It's not going to be anything drastic like that.
Interesting.
Yeah, I hope that makes sense.
I've had that question many times before. That's a good way to
That's,
answer.
that's a big one. That's a big question. So how do we know it works? Again, we are reducing 20 to 25% of the fat cells in that treatment area. And we know that it works because we have been super thorough in our clinical studies and our clinical trials. We have seen long lasting results. This slide says 9 years. It's actually been over 10 years now from the first couple of CoolSculpting treatments that we did. And we have been tracking them even to this day. We still track them. We still follow up with these people. One of them is actually a really cool story. It was a physician who was like, no way, this can't be. I don't buy it. So we talked him into coming in, learning a little bit more about our studies and our technology. We treated him on one side of his body. The other side we left untreated. And still to this day, you can tell which side was treated and which side wasn't treated. So it's super interesting. After that, he became a believer after he saw his results on that treated side, became a believer, and is now one of the largest CoolSculpting practices in the nation, which is really cool.
So he still has never evened out his other side?
Nope. Yeah, it's great. It's great because it just goes to show that it really does work and it really is providing long-lasting results.
Right.
And just to build on that a little bit more, the reason that they're long-lasting is because the CoolSculpting technology, like I said, is actually freezing those fat cells. So what a lot of people don't know, and something that I learned when I started doing CoolSculpting, is that when we're born with a certain number of fat cells in our body. Well, then we fast forward to adolescence. When we go through puberty, we hit that growth spurt, right? So we develop more fat cells during that puberty time period. After that, we never regenerate or make or produce new fat cells again for the rest of our lives. So the number of fat cells you have in your body is the number of fat cells you will have for the rest of your life. That number doesn't change. So what we're doing is when we're actually freezing and killing those fat cells, then they're naturally eliminated from our body. And once they're gone, they don't come back. Just a little caveat, because I do get some pushback on that. The only time that it's possible for the body to generate new fat cells is when we reach morbid obesity. So morbid obesity in the sense where your fat cells have expanded to capacity and they cannot expand anymore, then they split off into two, and so that those can then start to grow. Now, morbid obesity is very dangerous, and we're talking hundreds of pounds in weight gain. So the quarantine 15 is not going to put you to that limit. So that's a good thing. But that's just the only caveat. So basically, set number of fat cells. Once we remove 20 to 25% of those fat cells that are gone are never coming back. So there's some comfort in knowing that once you have this treatment as well.
Right. It's a good investment.
Definitely.
Yeah, I had CoolSculpting for the very first time, gosh, maybe a year and a half, 2 years ago. And I'm going to talk too much about myself and give too much away, but I think a lot of people do this. I always gain my weight in the fall. Mm-hmm. I do it a little more intentionally because, I don't like to give up my sweets and traditions of baking during the holidays. And then in the spring, I always intentionally burn it off, new year and new workout and eating right and all that kind of stuff. But so the CoolSculpting that I had on my inner thighs, I can see they still stay flat, but I still gain weight. And then when I lose my weight in the fall, then my overall thigh area shrinks, but the area that I actually had treated stays consistently the same, which gives you a little bit more of a balanced look, even when you do gain the extra pounds, which I really like that because it's not so noticeable. Gives you more wiggle room, I guess, if you want to gain the extra 10, 15 pounds during the holiday.
Totally. And since we're talking about ourselves, I also personally experienced the same thing. I treated my lower abdomen and got my stomach looking really great, how I wanted it. And then I gained about 19 pounds, which for some people doesn't seem like a lot. For some people, it is a lot. It's just your body type, your body, you know, everybody knows their own body best, right? But I started noticing through that weight gain that I was still maintaining my results. My stomach, the pooch in my stomach below the belly button, didn't come back the way that it used to be, or the way that it would have if maybe I hadn't done CoolSculpting. So that was something that was really interesting for me to see too, and also is why to this day I'm still still doing it, still in the business.
Exactly. You stick around and do things when you know they work, right?
Definitely, definitely. Okay, so we kind of covered this a little bit. So how long does it last? We talked about our long-lasting results. We're seeing maintained results for over 10 years now. The best results can be seen in 2 to 3 months after treatment. I'm going to say be patient with yourself. When you go through the CoolSculpting journey, that's exactly what it is. It's a journey. You don't want to rush to the mirror every day to see if you can tell a difference yet. It's a gradual process. It's the body takes time to recognize those dead fat cells as waste, essentially, and then it works to absorb into the bloodstream and then out through the lymphatic system. So it's just a natural process. It does take time. So I would even say be a little bit more patient and give it the full 3 months, maybe to even 4 months. And then when you come in for your after photos and compare them side by side, not only are you going to be able to tell in yourself just from looking at yourself in the mirror, but like in how your clothes fit and just your overall, your body, like I said, you know, your body, when you compare those before and after photos, I mean, sometimes people forget and they're shocked and they're like, oh, wow, I didn't even realize. I knew it went away a little bit, but I didn't realize it was this much. And then that's really exciting for all of us, I think. But again, once they're treated, they're gone. It's important to note weight gain after your procedure. This is so when we talk about weight gain after your procedure, as we said, we fluctuate, as women especially, we fluctuate all the time. Those like 5 or 10, those few pounds aren't really going to make a big difference. But we do like to document and talk to you about that through your CoolSculpting journey, from your initial consultation appointment all the way through your final appointment for your after photos, just so that we can document that. It is a medical procedure. We want to just have that on file and just know, but we also want to track, like, okay, well, it says here, you know, it looks like you've gained, 7 pounds. How are you? And it's good to talk through that and just know that, oh, okay, well, I gained 7 pounds. I'm still maintaining my results. So that's great. And then, maybe some things come along and you gain a little bit more than that. It's still just nice to be able to track everything and keep up with it. Consultation day. So the thing that I love the most about CoolSculpting is when we launched CoolSculpting back in 2010 or 2009, actually, we had 2 applicators. We had a small and a large. And now we have 5 different applicators. The technology has grown and evolved. We have a new way of assessing patients and tailoring your treatment plan. And it's so customizable. So we have all these different sizes of applicators, so we are able to put together a treatment plan for your body specifically. So we can tailor that any body type, any body part. So that's something really nice. Just know that when you come in, you are getting assessed in a way that is going to be a customized treatment plan for you specifically, and that's going to be designed to enhance your results that you're looking for. CoolSculpting treatment packages. So this is an example of CoolSculpting treatment package, and I'll just touch on it a little bit. When you come in, you may have this area in mind that you want to treat, that you struggled with it, you work out, you exercise, but it just kind of bugs you a little. So you want to get that treated. Then you realize all of these things that CoolSculpting can do, and we're like kids at a candy store, right? We want it all. So what these Like It, Love It, and Gotta Have It packages are designed to do is to kind of hone in on, okay, if, you know, sure, we want you to have the gotta have it package. Let's treat any and all areas that you want to be treated. Let's get you feeling good and looking good and confident. But maybe you just want to start with one area. So that's what we mean when we say the like it package. So for example, if I come in and I know I want my abdomen treated, I know I want my tummy looking good for summer, but I realize, okay, well, then my flanks probably need to be treated too, so that I can not only get that tummy sculpted and contoured, but I can get more of an hourglass figure, which is kind of what we're going for when we get down to really the contouring of the body. But then I'm so excited and I want to treat my inner thighs and outer thighs as well. I just want the whole package. So maybe sometimes we get a little excited, but maybe we want to reel it back in and we're like, okay, let's do the like it package. Let's treat the abdomen fully to completion, and then we'll go from there. And it's just an option to kind of break it up and design a treatment plan over time for you that fits your needs. Does that make sense, Allison?
Absolutely.
Okay.
Yeah, one of the questions that I get a lot is how many treatments does it take to treat to completion or to reach the goal? And obviously that depends a lot on the individual person and what their goal is. But what do you find is kind of an average number of treatments per area that you guys recommend?
So that's a great question. I will say, as a blanket rule, we do recommend breaking your treatment plan up into 2 visits. So for example, if I come in and I want my abdomen treated, and I use abdomen as an example because that's our #1 treatment area and it always has been. So if I come in and I want my abdomen treated and I have my consult with Jen and she assesses me and we come up with a treatment plan, I'm going to start my treatment on, like, what's today, the 16th. So if I start my treatment on the 16th, then I'm going to treat my abdomen, but then I'm going to come back in 30 days for 2 reasons. One, we're going to track my progress and we're going to take progress pictures. And then we're also going to reassess and we're going to complete the treatment that day. So the verbiage gets kind of confusing, and we know that we're working on that, but the best we can do is try to just educate you. You're going to come in for 2 appointments. You're going to treat your abdomen essentially in 1 session, and then 30 days later, you're going to treat the same treatment plan or complete your treatment plan and do the same thing again in 30 days. So why do we do that? The reason is because with each treatment, we are targeting that 20 to 25%. So what we're doing is targeting that 20-25%, and can you get a great result from that? Absolutely. But what we do is when we bring you back in that 30 days and we treat it again, now you're treating another 20 to 25% of fat cells in that same area. That's what's going to give you that wow factor. Is what is going to give you that wow result. That's really going to be just game changing for you and life changing for some people, just depending. But I think it's really important to keep that in mind. It's not that we are trying to just make you come back again and treat you again. We know that we can get those wow results. We can get that sculpted, contoured look when you follow our treatment plan as recommended. Great. I hope that helps.
It does.
So treatment day, we work really hard to make you super comfortable. At the Piazza Center, they have first of all, it's amazing. They have amazing staff. They're going to take very good care of you. It's really it's kind of a luxury treatment. So you're going to come in, you're going to get situated in in the treatment chair. We're going to hook you up, start your treatment. You can bring your computer to work on, your iPad. We can put on Netflix for you, or you can read. I've even had people fall asleep in the chair during treatment. So it's super comfortable. It can be relaxing. We want this to be a really good experience for you. I'm sorry.
You want me to go back?
Go back just a minute, just in case I left something out. Okay, so this just describes your treatment day. Of course, we talked about relaxing. When an applicator is applied, it's a vacuum applicator. So it very gently pulls the tissue into the cooling cup of the applicator, and that's the part that gets really cold and actually freezes the fat. Controlled cooling is what is delivered to the fat cells. So when we talk about controlled cooling, we did the work way back when, and we did these studies, and we found that when we target fat cells with at a certain temperature for a certain amount of time, that is what's causing those fat cells to go into apoptosis, which is basically fat cell death. That's what's killing the fat cell. We don't want to just shrink them or empty them out, or get rid of your water weight for the time being. We want to permanently destroy these fat cells so that you get that contoured look and it's long lasting and permanent results. So yeah, go on. Common side effects. First few days and weeks after treatment, you're going to be a little bit sore, a little bit tender to touch. That's totally normal. Sometimes you'll feel a little bit numb. So it's more of a just kind of strange, because you're like, well, I'm feeling it, but it's weird that I can't. It just feels numb to the touch. It's more interesting than anything. Redness, bruising, and swelling, that all varies patient to patient. If you know you're a sweller, typically when you do things, then you can probably expect to have a little bit of swelling. But when we talk about swelling, it's very minimal. It's not going to be like if you put on your bathing suit and go to the lake that day or that weekend, and you feel like you're swollen, it's not going to be like noticeable to where other people are like, whoa, what's going on? It's just going to be a little, you'll notice it because that's your body, and you'll feel it. Tenderness, cramping, and aching, that can be immediately after treatment for just a few minutes, I find. Itching and sensitivity and tingling can be one that can last a few days. What is really interesting and kind of funny is that after treatment, when everything's kind of working in there, those fat cells are frozen, your body's starting to recognize those fat cells are dead and the body doesn't need them anymore, then you do kind of start to itch in that area sometimes. It's interesting. Sensitivity and tingling is just more of that little numbness feeling. When we talk about soreness, you're going to feel like maybe like if you treat your abdomen, you feel like you went to the gym and had a really great ab workout, only it's not your muscles that are sore, it's like the tissue that was treated, which is a little strange, but that's essentially what it feels like. The numbness can last up to several weeks. It will resolve on its own. It's totally normal. Now let's get into before and afters. So these are some before and after pictures that were submitted to our training center and our training team. These come from doctors all over the country that have just experienced really great results and wanted to share them with us. And then in turn, we want to share them with you. We want you to know that these came from just varying practice. It wasn't just something that we threw together. These are real results from real patients, so it's super exciting. This is a before and after. I love this one. It's 5 months after CoolSculpting. That person got a great result. We can just kind of go through these kind of quickly. Here's another one, was treated 16 weeks after the CoolSculpting. So this one I love too. We also, we treat a number of men too. This I find is a treatment that, a lot of men aren't into the aesthetic treatments or as informed about them as women are, but we get really, really nice results with men, especially in that midsection, especially abdomen and flanks, and the chin is a big one for men too. Another one, 14 weeks after CoolSculpting. This is another great ab. You can see that muscle definition coming out after the fat is reduced there. I love this one. Some of my favorite photos are from the back view, because we never look at the back of ourselves. So this just is really a really nice contour. You can see exactly which pockets of fat we targeted and then eliminated those with CoolSculpting. So really nice results. Here's another one, great volume reduction. This is 16 weeks after CoolSculpting. courtesy of Bodify. Bodify is great. They do great. They have great before and afters, as you can see. Inner and outer thigh, that's a big one too. So we're not treating circumferentially, we're not treating like around your entire thigh, but what we find is if we target those pockets of fat just right there in the inner thigh, and then those what we like to call saddlebags right on the outside, you can appear to get a circumferential reduction just by targeting those little pockets. Here's another one. This is inner and outer thigh. You can definitely see that outer thigh. It just kind of looks like it was shaved down a little bit. And that's the beauty of our outer thigh applicator that we designed specifically for that area. The chin is a big one. We talked a little bit about how not only is it going to reduce the volume, it's going to retract the skin as well. I think that this is a really great result 12 weeks after. So I think it made this patient look a lot younger, in my opinion. So that was a really nice result. Arms, we can treat upper arms. So that little flab, that little bat wing area, we can target that with CoolSculpting, which is really nice. It reduces very nicely. And then here are some patients that were treated at the Piazza Center. So as you know, they are CoolSculpting experts. They have been through all of the advanced training that we have to offer, and they are just getting fantastic results. So it's really nice to see. This was a patient that came in and treated her abdomen.
Yeah, I like how it almost looks like you can see her muscle definition, but you can also see the fat in her back right under her bra area, how that
definitely
as well.
This is another great one. Another great one to point out is the muscle definition on this too. So when we reduce the little pockets of fat, or that layer of fat that's on the abdomen, you'd be surprised what you can find underneath there.
Yeah, we have a lot of people that come in that are athletes. They're pretty trim and slim to begin with, but we have a lot of people that complain, you know, I work out, I'm fit, I eat pretty well, I'm at my ideal weight, but I have, you know, either the lower abs, I just can't get rid of them no matter what I do, or my thighs. You know, everybody has kind of a different area, and the CoolSculpting is great for that because you work so hard, you want to have the whole picture, but you've got one or two areas that are just so stubborn, and CoolSculpting wipe it right out.
Definitely. I love this one. This is a great example of targeting those flanks. So what people call them love handles. People don't like the way that their pants are hitting when they wear their clothes. So this is a great way to reduce volume there, make you feel a little bit more comfortable in your pants. But also we can use the flank treatments to give a nice hourglass curve to the body as well. So that's a really nice reduction. I love this one. This is phenomenal results with the inner thighs. People talk about the thigh gap. That's the big thing now. So a lot of patients will come in and really will say, I want the thigh gap. So it's a really nice targeted treatment for the inner thighs.
That's a big change.
Mm-hmm. Again, not just for women. I mean, look at the great reduction on this man. So when we're treating men, and you can tell in the flank area, but when we're treating men, we like to give them, we usually just stick to the lower flanks, and we like to give them that more V shape, the more masculine shape. And then with women, we can target the upper and lower to give more of an hourglass. So really customizable, which is great. Another chin. The chin is in, or the chin is not in, I don't know. Here's another male patient. We treated flanks, another great result. You can definitely see where we targeted that flank area, nice reduction there. And looking good in the media. Did you want to speak on this, Allison, or?
No, I just thought I would put that in there because, you know, CoolSculpting is cool.
Yeah.
And there's a lot of talk about it because it works. You know,
Yes.
a very popular treatment because it works. There's no downtime. It's easy. And again, when you have trouble trying to get rid of those pesky areas of fat, this is the answer.
Definitely.
So we are running probably the best CoolSculpting special that I've ever seen out and about, and it includes buy 3 treatments and get 1 free, or buy 4 and get 2 free. So that's up to a $1,500 value. And, you know, I always have to say, just because it is a little bit confusing about how we do the treatments, like Michelle said, if you're doing one area, let's say, for example, your abdomen, you may need 1, 2, 3, 4 different treatments to get you to completion. It just depends on your body. It depends on your goals. So what we like to do is have you come in for a free consultation. Tell us a little bit more about what you're looking to achieve, and then we can give you that ideal treatment plan and work out the best value with this promotional deal that we can. So this is going to go through July, and in our email, the follow-up email that I send tomorrow, I will make sure that this is outlined. And if you're interested in setting up a free consultation, just reply back to that email or give the office a call that you saw the webinar and that you would like to schedule to take advantage of the promotion, and we'll get you scheduled and get you to come in and kind of see what treatment would be best for you. So in conjunction with that special, just to sweeten the pot even more, there is this amazing promotion that Allergan is offering through Brilliant Distinctions. It's $500 off 6 or more treatments. So most people will likely want to go with a 6 or more treatment package. Again, it depends on your body and your goals, but that is another huge chunk of $500 off, and you can apply that to the promotion that we're also running in the office. So this is another great way to stack your savings. And this one we get through following a link. So I'll include the link to grab this coupon for yourself, and I'll include that in the email tomorrow. Do we have an expiration date on this one, Michelle?
So this offer is actually going to be good through the end of August.
Okay.
So definitely paired with your deal, though, I think I would jump on this and take advantage in the month of July for sure.
Absolutely.
But yeah, this is just something to just kind of make your re-entrance. It's kind of make your re-entrance back into the world after COVID. I know we all were quarantining and kind of staying home, so this is kind of something nice to treat yourself and get back out there.
Exactly. So if you heard me say Brilliant Distinctions and you're like, what's that? No worries. People that are Brilliant Distinction members can just quickly log in through the link and add this to their Brilliant Distinctions account. If you are not a Brilliant Distinctions member, no problem. It's super easy to sign up. It's free. Obviously, it's 100% worth it to get the $500 off. So we can help you through that if you have any questions as well. So I know we were kind of answering some questions along the way, but I have seen a couple pop up that I wanted to direct to Michelle. Of course, the question of what does it feel like? Does it hurt?
Sure, yeah.
One that we get asked a lot. So curious to see how you would answer that.
Yeah, so honestly, I wouldn't say it's painful. I don't think it hurts. Everyone's pain tolerance is a little bit different. What I would describe it as is it can be a little uncomfortable. And when I say uncomfortable, it's because if you think about it, we're putting this applicator on your body, and this applicator gets very, very, very cold. So we're talking below freezing. So as the applicator starts to get cold, it can feel like when you have when you've hurt yourself or you have an ice pack on your skin and you're leaving it on there for a few minutes, it starts to sting a little bit. So I would say for the first 8 minutes is when you're going to feel the temperature coming down. You're going to feel that really cold feeling, and then once it starts to get uncomfortable with like a really cold, like stinging, the area ends up going numb. So, which is totally normal. It's very safe. It does not have any effect on, like I said, skin, nerves, any other underlying tissue. What's beautiful about this treatment is it targets fat and fat only. But that's a little uncomfortable when the applicator comes off, and you are a little bit frozen still. We do a 2-minute manual massage. That's to break up and kill additional fat cells. So that part can be uncomfortable for some people. Most of the time it's pretty tolerable though. We don't usually have any problems.
Yeah.
So I would say it's like comparable to sticking your hand in the ice chest when you're looking for a drink or something.
And right when it gets to that point where you're like, ugh, yeah, this is really cold, then you don't feel it anymore because you've gone down.
Yep.
That's a perfect description. So the other question I see is, can you treat multiple areas at one time?
So at one time, no. So what we do is we have whichever applicator is a fit for that body part or body area that we're treating. Each applicator placement, and then this is to back up and a little bit more clarification on the buy 3 get 1 free, or the $500 off the 6 treatments. Again, the verbiage gets a little confusing, but we'll walk you through it so that you understand what's going on. Each applicator placement is what we mean when we say cycle or treatment. So to cover the abdomen, if you're treating your entire abdomen, that's typically 4 to 6 treatments or cycles. So if you're wanting to fully treat your abdomen, you're typically going to need about 8 cycles. So that's what's perfect about the buy 3 get 1 free, or buy 6 or more and get $500 off. You're able to take advantage of these offers and get some discounts on based on your treatment plan, because you're going to need that many anyway.
Yeah, that's awesome.
Yeah, and you can treat multiple areas in one day, just not necessarily at the same time. So each applicator, for further clarification, each applicator placement is going to be about 35 to 45 minutes treatment time. So if you are treating your abdomen all in one day, you're going to need to plan on your treatment being a couple of hours long.
Perfect. Well, thank you, Michelle. This was amazing. Super informative and fun. So thanks for being here with us today.
Of course. Happy to help. And thank you to all of those who tuned in. And again, if you have any other questions, feel free to reply back to Allison's email.
Yep, that'll go out probably tomorrow around this time. And we'll try to include the recording of this as well. So feel free to share that with friends and family. Of course, I had mentioned earlier that in the previous email that we would love to give away a package of free CoolSculpting for the person that shares the most with their friends, and for those friends that can join us on the webinar. So I'll look out for that, and you guys look out for the email tomorrow. Thank you.
Thanks, everyone.